Thanks, Norman, for coming on the program. Hey, what's going on with Hong Kong?
Well, I think that they're seeing low vaccination rates in aged care. They've been vaccinated with Chinese vaccines, which are probably almost certainly not as effective. Really don't know how effective they are. And what you're seeing here is what we've been saying on this show now for weeks now, is that Omicron is not a mild virus. It's simply less severe than Delta, but it's about the same as Wuhan. And what you're seeing in Hong Kong is this virus going through people who are under-vaccinated or been vaccinated with a less effective vaccine. And you can see what happens with the death rate when that occurs. China is now experiencing outbreaks across the country with lockdowns in Shenzhen and other places. They're building, I think it's Shenzhen, they're building a 6,000 isolation facility. What they do in China is that they actually admit people who are infected into an isolation facility whether or not they are sick. So you're seeing, and reportedly it's BA2. What you're seeing here is the fact that this pandemic is far from over.
And speaking of far from over the past couple of days in New South Wales, the health minister there has also been very front foot about warning about an expected rise in COVID cases and the corresponding need, Norman, to lift booster rates.
Yes, but New South Wales, as usual, is slow to bring in simple things like mask wearing indoors to just slow things down while you increase the rate of. Now remember, these are not boosters. These are the third doses you were always meant to have. Still using the language of boosters makes people think it's take it or leave it. To be up to date with your immunization, you really need 3 doses. And as this goes up, with vaccination will hold the line against severe disease, but you will see, you may see hospitalizations and deaths go up as it becomes more pervasive, and that's, and he was expressing that concern. I mean, we're lucky in a sense that BA2 does not seem to be inherently more severe than BA1, but it almost certainly is more vaccine evasive.
Brad Hazzard yesterday on the program was saying about the masks that people are just over it. And that was the reason why not to bring back any restrictions. Well,
you're seeing at state level and federal level people talking about post-pandemic, that the pandemic is over, which is what we'd all love to believe, but just saying it doesn't make it happen. The pandemic is not over. And we have to be prepared to move in and out of these measures. I mean, not lockdown, but in and out of these measures which do slow it down. Masks do slow it down. We had a really interesting question on CoronaCast last week, was how many people has been infected before me since Wuhan for me to be infected? And the number is in the hundreds. It's actually not as big as you would think. But each person has a lineage going back to Wuhan, and what you got to try and do is make yourself the end of the line so you're not passing it on to anybody else. And that's what masks do.
Norman, I know that you will have been taking a great interest, as I have been, in COVID case numbers which are rising in the UK. And in particular for you, Scotland is seeing its highest hospitalisation figures in well over a year now.
Yep, and the BA2 has gone from, according to a report just out, 50% of cases in February to 83% of cases now. And Britain has not achieved the level of vaccination that we have achieved here in Australia.
But they have no rules there. Essentially, it's pretty much free for all over there in the UK.
Open up, yeah, a few more rules in Scotland than in England, but essentially they opened up and have gone to a much lower level of regulation than we have here, and you pay the price for that, unfortunately.
Dr Norman Swan, thanks for joining us this morning.
Next time, good news, perhaps.
We keep waiting.
We hope.
No pressure. Thanks, Norman.
You're welcome.